Okay, so hello and welcome. Thank you everybody for signing up to this webinar. Today we're going to be looking to the future of advanced practice for particularly SLTs and occupational therapists. Whilst we specify speech and language therapy and occupational therapy, we do hope this work can create opportunities for all health and care professionals, no matter where you are. Once again, we also do apologise for any confusion that builds up to this event. It's attracted a lot more people than we expected it to, in all honesty. So we've had to update Teams licenses last minute and so on. So if anyone is missing, please feel free to invite your colleagues and so on to this meeting. But once again, please make sure your cameras and microphones are off, just so we can, so we don't impact that at all. Thank you. As always, we do need to just touch on housekeeping. So this event will be recorded today and will be shared wider. Therefore, once again, keep repeating it. Please keep microphones and cameras off. This will also help with internet access as well, internet connection. So please do use the chat function. Leave all your thoughts, your opinions, your attitudes in the chat. We may not get through everything today, but we will be going through the whole chat again after this session and taking notes and looking to answer any questions that we haven't got through. Thank you also for all of your questions, your pre-submitted questions. We've got lots of them in, so around 150 to 200 pre-submitted questions, which is fantastic. Thank you. We will aim to share these, the outcomes of these with you. We've tried to intertwine it with many of the sessions with the speakers today, but obviously it's not possible to get through everything. So hopefully we'll be sharing an FAQ document in the near future as well with the follow-up of those questions. So the main aim of today is to create a change movement. We want to broaden the opportunities for speech and language therapists, occupational therapists, and just other health and care professionals in general in the advanced space. And our objectives. So objective 1 is to contextualise the future of advanced practice for allied health professionals. Objective 2 is to share an overview of the project led by Dr. Kim Stewart and Louise Henstock in 24-25. And objective 3 is to position this new model of advanced practice. Now, whilst we are presenting a new model, we don't want this to replace the existing model at all. That's still really important to have both opportunities to reach advanced practice. This is to work alongside. And objective 3, this is to see how you can remain involved and shape the future of this work going forward. So now quickly just touching on the agenda, as we touched on, this is a full agenda today, so we won't have time to go through loads of questions, but we will get to those at a later date. So first of all, we've got Beverly Harden speaking. So Beverly is the Deputy Chief Allied Health Professional Officer in England and also the lead for AHPs in advanced practice. Despite being from England, the goal of this work is to translate to everyone no matter where you're located. So if you are in a nation, we do hope this will work for you as well. We'll then have Dr. Kim Stewart and Louise Henstock to talk through the project in a little bit more detail. After this, we'll have Stephanie Tempest with her HCPC Clinical Fellow hat on. And this will offer a perspective of governance and regulation of the advanced practice space. And then finally, we'll hand over to Cara Norman from RCOT with a reflection on behalf of RCOT and RCSLT before Claire Guyat will take over and offer the final remarks from RCOT as well. So first of all, we'll hand over to Beverly. Thank you everybody much for attending today, and I hope you enjoy the session. So to you, Beverly.
I'm on mute. What a way to start. It's me. Anyway, people, welcome. This is an incredibly exciting moment. Could I try my colleagues to go to mute? I like hearing myself once, hearing myself twice is a terrible thing. So I just want to first of all start by paying absolute testament to the courage of Cara Norman and Judith Broll, who when I approached them and said, the time has come to disrupt, they both said, absolutely, we agree. And those professional bodies have absolutely led with huge style through this process, matched only by the courage of Kim Stewart and Louise Henstock, who then received the commission to do this work, and I have to say have blown the lid on it. So well done, everybody. And this is a defining moment for advanced practice, not just within speech therapy and occupational therapy, but this absolutely changes the mould and says, as Will has eloquently just said, we value the entire spectrum of advanced practice. And this is potentially one end of that spectrum, but just as valuable, just as important, and just as alive and well as the other end of the spectrum. It's just people don't understand it so well. We don't have the same privilege for people working in this part of our community, and we need to correct that and level the playing field now, I would suggest. Hence this work, and hence the courage of the people who have driven and led this work. So when this work all really kicked off in 2017, I got involved because I could see this work becoming medical model dominant. And nothing should ever be dominant of one or the other. We need to flex and be able to respond. And so this for me now, I can't even work out how many years later, but a lot of years later, is the moment that I have been waiting for to really start to say the whole spectrum is here now. And I remember at last year's Advanced Practice Conference, please see the queue above me here for this year's Advanced Practice Conference, you need to be there. I heard the most fantastic occupational therapist talk about her experience of working within integrated care services. And she said her job was amazing, the things she could do with her population was amazing. The sadness was that she had to be squeezed into a medical model to be able to do the job that she knew she could have huge impact through. No one should ever have to be squeezed into the wrong model of care to be able to be recognised, to be able to gain training, to be able to deliver for our populations what we all know we are capable of offering for our population. So today that ends. I just need some more courageous people to come on the journey with us. We need more of the professional bodies to lead with us in this space. We need universities to courageously step forwards with us. And we need employers to absolutely stop, think, acknowledge and recognise the huge opportunity of advanced practice. We're doing it already. None of this is new. There's nothing new for people here. You're doing it. We're maybe calling it something different. We haven't recognised it yet. Maybe it is happening beautifully. It is recognised, is remunerated, and it is understood. Wonderful. All of the above are possible. So what we need to think through, though, is that this is a product of our whole health economy. And working through social care, justice, education, we've really got to think through what this means across the entire spectrum of where we work, the work that we do. And the work that we do might be social capital building. It might be so far away from a medical model you can't even see it. Great, fantastic. All of it is valid. All of it is valued. All of it is desperately, desperately needed. And having spent 4 days in hospital with my beautiful mother, I absolutely say you're needed more than ever before to blow apart how we can really start to change care for people and for patients. So this is an inclusive agenda. Everybody here needs not only to think through what this could look like, but we need to get involved in making it happen. It will be down to us and our implementation, how we really do drive this. As Will said, although he did say the words despite coming from England, William, I'll have words with you about that later, this is a four-nation construct. You all work as colleagues working across 4 nations, delivering to our population of England, haven't I? Great Britain. And the 4 chief officers work together all of the time, driving forwards. And you'll see on the HCPC website the chief officer's statement about advanced practice, the value of advanced practice across the entire spectrum, and something not defined by prescribing. It's powered by our brilliance and the sharpness of our minds, not the sharpness of a pencil writing a prescription. It is the sharpness of our clinical reasoning, problem solving, and our ability to drive change with and alongside populations. And you think of the government 3 shifts, digital, absolutely, clinical, the ability to move care into the community, and the ability to really start to drive prevention. And when you think about prevention being everything from health inequalities, the child in school being able to communicate, hold a pencil and sit still long enough, right the way through to care at later life or the end of life, think through absolutely the impact that we have in all of those spaces and the ability to unleash the advanced level of practice, preceded by enhanced practice and with consultant practice as part of a continuum of keeping our brightest and our best absolutely engaged in delivering care alongside within our populations. So really think through, and don't forget government agenda is actually underpinned by one mission, which is the building of strong society, the ability to keep people in work, stay economically growing as a nation, and be able to prevent the social disenfranchisement we saw with the riots of last year. That is what we do. We build social capital by working with and alongside people and communities. We're proud of it. We need to do more of it. We need to create a career path that enables people to do it, but be trained to do it. And again, that is the outcome that I need to see from today, is I'm looking for university partners in service. But I probably put myself onto mute, if you wouldn't mind, colleagues, please. Because the work starts now and the work starts here. We want to drive change. We want to stay in that courageous space. We want you to get involved. I want you to sign up for the conference. I want you to get involved in the post feedback from today. And I want you to stand alongside Kim, Louise, Karen, Victoria from this College of Speech and Language Therapists and drive this magical moment. It'll only be what we make it. And the nature of the moment means it's going to be tough, But together we can do it because it is a long time coming, and I want to build on the brilliance of what you do. It doesn't matter if you work in the NHS or the independent sector or voluntary service, but it doesn't matter where you work at all of your ability to work at this level of practice changes the game, not just for people and their carers and their families. It changes the game for the taxpayer, it changes the game for service provision, and it builds sustainable health and care for us, for our families, and for the people we serve. So there's nothing to lose. We've just got to make it happen. So onwards, people, let's go make it happen. Well done, College of Speech Therapy and the Royal College of Occupational Therapists. Marvellous. Your leadership has been unbelievable. William, you are an absolute marvellous creature. So thank you for what you've done, William, to make this come alive.
Thank you very much, Beverly. And I'm sorry, hopefully Beverly doesn't catch up with me anytime too soon. But thank you, Beverly, that's great. Now we will just hand over to Dr. Kim Stewart and Louise Henstock. They led the project initially, so they'll be able to give a bit more information about how it went and what the plans were. So just handing over to Kim and Louise. You'll need to both start talking so I can spotlight you, sorry.
We're here. Found us, Will. Thank you. And what a rousing introduction from Beverly there, which really sets the scene of our work. So my name's Kim Stewart. As Will said at the beginning, I'm an occupational therapist and worked with Louise as part of the programme and a team in reimagining advanced level practice. Next slide. I feel like Chris Whitty again. When we took on this piece of work, what we absolutely needed to recognise is that across all nations there is a consensus for advanced level practice that is underpinned by an understanding of all of the pillars of practice, and that through this we can absolutely optimise and drive forward health and care across a population level, and that when practitioners work with synergy across all of those pillars, working at an advanced level practice, they function in their role in everyday practice. However, we also recognise that the exact nature and purpose of advanced level practice is very much contextualised within their profession and a particular role and a particular sector. So what we were wanting to do was really come together as a collective understanding about working at advanced level practice, understanding that registrants have the ability to lead complexity, manage uncertainty, and proactively address risk. And that with increasing complexity in practice, registrants are able to advocate, influence, and lead by recognising the multiple interdependencies and structures that underpin our effective health and care provision in order to be change agents. So, when we took on this work, the purpose of our project was to examine advanced level practice from the starting point of the multi-professional understanding, and then take that and look back through the lens to the profession-specific nature of advanced practice, and really think about how we can maximise our profession's impact across health and care. Next slide, please. So what's really important when we think about advanced level practice, and we started on this work, was to look at advanced practice as a continuum and to really celebrate the nature of advanced practice in all of its perspectives, but have an understanding where there is a common and shared purpose within and across professions, and to absolutely say that there is value in difference as well as unity, and that recognising advanced practice roles can be developed within and or across professions, and that different sectors will have different needs but all have an equal value. What we need to be able to be clear on is the intent of the role and the level of practice, and bring together impact that might be different. So what we did was build on and from, but definitely not replace. And it's about how we come together as a coalition and recognise and value the work that's already been done to date. The clinicians that we spoke to spoke with absolute joy, but also of the challenges that they found themselves in establishing advanced level practice. All of those perspectives are absolutely vital to taking this forward. Next slide.
Thanks, Kim. So for this project, the sprint approach provided a structure that enabled us to move quickly and collaboratively towards a shared goal, developing a profession-specific understanding of advanced level practice. The key to this process was co-production, bringing together the full breadth of voices across professions, across sectors and pathways, and across all nations. We wanted to ensure that every perspective within the health and care system was heard and could shape the outcomes. And the methodology was structured across 3 iterative sprint phases: collaborate, innovate, and accelerate. Next slide, please. So in phase 1, in Collaborate, we focused on exploration. We had 3 major insight events, 1 for all AHPs and 2 profession-specific sessions for occupational therapy and speech and language therapy. These events examined their characteristics of advanced practice, professional development needs, and profession-specific structure that supported advanced practice. Alongside these, we used an online engagement tool to widen participation and ensure that those unable to attend the sessions could still contribute their perspectives. This ensured inclusivity and equity of voices across the project. In phase 2, Innovate, this was further developed and tested through a thought leadership insight event, which engaged experts across academia, practice, social care and health systems to challenge, refine and strengthen the concept. And finally, in phase 3, Accelerate, this phase focused on aligning the outputs with stakeholder needs and national frameworks. Next slide, please.
So, when we started on this work, our job was to look and be careful about how we considered advanced practice across all professions, to really understand how allied health professions play a critical role both inside and outside of statutory provision and sectors. So our work was taken forward with positive disruption at the heart of it, really thinking about advanced practice within a social justice lens to consider the impact of occupational therapy and speech and language therapy in addressing health equity at a system level. We wanted to be able to create and think about how we could break through the boundaries for both of those professions in promoting occupational therapy and speech and language therapy that fostered an equitable access to advanced level practice opportunities that really harness the unique contributions and expertise of those professions and link to wider care sectors such as the justice system, education, housing, social care, to name but a few, to think about how those sectors and occupational therapists, speech and language therapists and other professions might then interact in a way that impacts on the determinants of health equity at a community and societal level. What we wanted to be able to do was to innovate and to collaborate, to look at new ways and new considerations of emerging opportunities for these professions to impact on health inequalities at a population level, using expertise, leadership and research to underpin their profession. Next slide. So why did we look at it through the lens of health inequalities and social justice? In 2010, Marmot wrote, "Health inequalities are not inevitable and can be significantly reduced. Avoidable health inequalities are unfair and put people not in the heart of the matter of society or justice." And then again in 2020, he wrote, "What we can envisage and work towards is a society that creates the conditions for everyone to lead lives that they have reason to value, and that we do not have such a society at the moment. Many of the underlying drivers of poor health are located outside of healthcare itself, and that in changing these policy shifts, we need to think about building systematic, sustainable and achievable social approaches in how we deal with health equity, bringing together multiple sectors such as education, justice, housing, social care as equal partners in collective action. Therefore, taking a look at advanced practice through this lens, using social justice, social capital and social impact as tools for change. A simple but effective way to consider this is social capital. So social capital has been identified and evidenced as having a strong determinant in improving health outcomes. Quite simply put, it's around orientating practice to focus on what supports our population to be healthy, happy, housed and hired. Where societies have higher levels of social capital, we're in a greater position to address poverty, vulnerability, resolve disputes and promote growth. By articulating our advanced practice in this way, not only do we recognise the breadth of professional practice, such as community settings, education, early years support, SEND, trauma-informed care, the justice sector, housing and environmental adaptations, that enable people to participate in everyday life, to retain their work roles, we can also create evidence that captures the longitudinal impact that our professions have. We're in an economic health loop at the minute that focuses on what has happened and drives funding models towards outputs and is about capturing what happened rather than what didn't happen. Because as a profession, as a health and care professions, quite often we're there to prevent occurrences of care. Think about all the times that community services and social care have prevented an admission, all the interventions that happen in the classroom supported by speech and language therapists, occupational therapists, that means a child can now access their learning in a way that enables them to thrive. All of those events recognise and impact not just on the here and now, but ripple beyond the clinical encounter into our society for years to come. These are examples of how we might articulate advanced practice through a social justice lens. But how do we do that? We place professional authority at the centre of what we do. So professional authority is a concept, next slide, that's built on trust. And trust is a key factor in quality and performance within health and care systems. The Organisation for Economic Community Development published a Paris report earlier this year. It's an excellent example of how we can demonstrate that there's a clear correlation between the relationship on societal trust in our healthcare system, national policy, and its impact on health outcomes. There is a wealth of evidence that suggests that when people have high levels of general health, they are more than 20% more likely to trust the health systems in which they live. Conversely, when people report poor health and mental health issues, they also report a self-report 6% less trust in the health systems. And therefore, our performance and our expertise, our professional authority, confers that trust to the people we work with, and that our capabilities and competencies reflect both at an individual level, a community level, and a population level. So across all of our professions and our nations, we are prioritising work reform for advanced practice to realise the fullest potential and optimise every contribution that our professions make at a population and individual level need. It means we need to operate through different models of service delivery and in a multi-professional way. So for advanced level practice, this is exercising our high level of autonomy in highly complex clinical decision-making situations, working with people in partnership to improve outcomes. So within the scope of practice in reimagining advanced practice, we were really keen to explore the relationship between knowledge, its application through mastery in everyday practice, and evidencing the impact that we can have as occupational therapists, as speech and language therapists, as health professionals in addressing health equity by driving forward social capital at a person, people and population level. And then when we think about professional authority, we are able to articulate the expert knowledge domains within our professions, and that we can use them in our practice and evidence the outcomes that are unique. In other words, show how we address health equity, and therefore understand how this level of practice can be part of a continuum in affecting health and care. Next slide, please. We've already said that the nature and purpose of advanced level practice is different. It can be considered in lots of different ways, but there is some commonality in how we think about professional authority in the way that we practice that is influenced by contextual factors. We already recognise that there is generalist and a specialist way of looking at advanced practice, but they can coexist. And the expertise that underpins your scope of practice is influenced by the context of your care, the health population needs that are presented within your role, the locality, the geography, the diversity, and the impact and outcome that you are learning and developing within your practice. For example, generalist advanced practice requires a broad level of knowledge, skills, and its application across multiple populations. It requires them to be versatile and to show and be able to contribute working in a dynamic environment across rural, community and urban populations. Those practitioners need a different level of support, education and development to others. And often when working in a generalist sector, you're taking on social accountability for your communities, your localities, and you're driving change across your population. That is different to specialist advanced level practice, where it's about understanding that deep understanding of expertise and proficiency within a particular speciality or particular area. And that requires practitioners to delve into a particular way of working with high levels of autonomy and high levels of specialised care and complex need. Next slide. Next slide, please. So where does that take us? What we wanted to be able to do was really think about representing advanced level practice in a way that shows the unique understanding of advanced practice within a profession, but also across a profession, to look to produce something that is reproducible, but also representative across our professions. By focusing on social capital, we are building societies that have higher level of civic responsibility and higher level of being able to address poverty, vulnerability, resolve disputes and promote growth. Ultimately, health equity is about having a workforce that can tackle the broad social and cultural challenges underpinning our society and use robust evidence around social and economic impact. Using social justice as a way to capture this and think forward enables to consider the nature of society and justice as a health protective factor and actually think about diverse areas of practice such as housing, education, communities and neighbourhoods to really think about where we can provide impact for those areas. And by understanding our professional authority within our professions, we can articulate the expert knowledge within a profession. And then lastly, we know that workforce reform must happen. All professions, all nations, thinking about how to reform their workforce and drive forward change for advanced practice to enable all professions to reach their fullest potential and optimise the contribution of that profession to meet our population needs for individuals, for families and for carers. That means different models of care, different modes of service delivery, working in partnership, building common metrics that capture social change as well as health outcomes.
Right, thank you very much, Kim and Louise. That was really interesting, and thank you for providing all of that extra detail. As some of you have seen during that, links to the actual reports have been available in the chat, so please do flick through those and try and find those at some stage as well. So we're now just moving on to Stephanie Tempest to have her views from sort of governance and regulation side of things. Stephanie's doing this with her HCPC hat on today, so thank you, Stephanie.
Thanks, Will. And it's both a privilege to be here and slightly daunting to follow such amazing speakers. So thank you for having me. And it's brilliant to be part of this conversation and part of the discussion, especially seeing how the conversation aligns across national bodies, professional bodies and the regulators. So thank you for inviting me here today. I've been asked to provide a brief overview to place this discussion on the future of AHP advanced levels of practice within the regulatory framework. My name's Stephanie Tempest. I'm an occupational therapist, and I've had the pleasure of working across both professional bodies in my career so far. So I'm going to share with you a little bit about the role of HCPC as the regulator, with a particular focus on scope of practice for experienced practitioners. Next slide, please. I also want to say the chat has been absolutely amazing as we've gone on, so I hope my previous speakers can have a look at that whilst I'm speaking as well. By way of introduction, as I'm sure you know, HCPC is the UK-wide regulator for 15 different professions, including those under the umbrella of AHP, biomedical scientists, clinical scientists, practitioner psychologists and hearing aid dispensers. And arguably this conversation we're having today extends beyond, right across all of those regulated professions. As a regulator, the role is established by statute. It's an act of Parliament. And in the case of the HCPC, it's the Health Professions Order of 2001. The order clearly sets out the overriding objective of the regulator, which is to protect the public. And you can see the three key features listed on the slide. Next slide, please. So HCPC is protecting the public, and as with other healthcare regulators, it also sets standards that we're all held to, quality assures pre-registration education, and takes action to protect the public through fitness to practice. So this means that registrants like us working at advanced or consultant levels of practice are already fully regulated. You must meet all the HCPC standards relevant to your scope. As part of the process, all registrants must engage, as we know, in outcome-focused CPD, and I've been mentioning that in the chat as we've been going on as well. As part of the process, all registrants must engage in this, reflecting on your scope of practice, recognising that that is also an evolutionary process in and of itself. So alongside setting and maintaining standards, protecting the public through fitness to practice, HCPC also gets involved with sessions like today, getting involved further upstream to support people to use standards in practice, and also listening and collaborating with colleagues to take all of the information back into the regulator as well, especially and including as we advance in our careers. Next slide, please. Before we talk about the standards and in preparation for today, I pulled a resource from one of my favourite books. Nankara and Borthwick have written something around the sociological perspectives of AHPs. And I just wanted to share this with you. Allied health professions are innovative, responsive, nimble, and able to adapt to a wide variety of changing populations and organisational contexts, adjusting our roles and responsibilities accordingly. And I thought this was particularly relevant for our conversation today. And this is what we do. AHPs reimagine practice. We have a long history in doing this. So while some of these concepts you're hearing today may sound new, or they may sound like areas for further CPD and further investment in your learning and development, I think it's fair to say that we've been positively disrupting the system for a number of years, if not decades. If we go on to the next slide. From a regulator's perspective, what do we mean by scope of practice? So your scope of practice is the area or areas of your profession in which you have the knowledge, skills and experience to practice lawfully, safely and effectively in a way that meets the standards and does not pose a danger to the public or yourself. So whilst we're talking about being flexible and adaptive, that doesn't mean that we're running wild and free. It means we adjust our roles and our responsibilities within a regulatory and legal framework. The HCPC standards are designed to be enablers, so to enable you to make appropriate adjustments to meet the needs of the people you serve. And that's the whole point of them. They are set in place to protect the public and to serve them well. And as registrants, our job is to choose the CPD activities that enable us to grow to meet the needs of the people we serve. So we know that all registrants, including those at advanced levels of practice, must operate within the standards of proficiency, which are relevant to their scope of practice at every career stage, and work within these high-level standards of proficiency for the individual professions, and also the standards for conduct, performance and ethics. So what I'd like you to take away from this conversation is the standards recognise that our scope of practice changes over time, which is one of the reasons that they are high level, and they're not a restrictive list of defined activities which would become out of date quite quickly. As we advance in our careers, we gain from our experience, our learning, and for some of us additional qualifications, which enable us to manage higher levels of risk and complexity and broaden our spheres of influence, as our previous speakers have spoken about. Next slide, please. Standard 1 talks about practicing safely and effectively within your scope of practice and identifying the limits of it, seeking advice, knowing when to refer on, managing your workload and yourself within the process, and keeping your knowledge and skills up to date, understanding the importance of CPD throughout our careers. I'd recommend watching our scope of practice. There's a recorded webinar. It's about 17 minutes long on the website. Florence does an excellent job of applying the standards within the context in a way that I don't have time with the 3 minutes I've got left with you now. But to this end, what I'd like you to take away is view scope of practice as having two interrelated parts. We have our profession's scope of practice and you have your own individual scope of practice. Both will change in size and shape as you grow into advanced roles and gain more experience based on the needs of your individual service users and populations at that time. Okay. For example, it's within my profession's scope of practice to splint, but I haven't done it for over 15 years. So if I was to bring that back into my individual scope of practice, I'd need to engage in additional learning to do so safely and effectively. Additionally, as I've gone through my career and advanced, I've extended my individual scope of practice beyond what is traditionally accepted or traditionally done within occupational therapy, but I can demonstrate that I've gained additional qualifications and I've grown appropriately to meet the needs of the people I serve. And that's what we need to be able to do, confidently articulate the narrative around our scope of practice. If we go on to the next slide, Bev covered this already, but there's a statement there. It's an excellent statement on the written by the chief AHP officers for each of the 4 UK countries. Please do seek this out. It talks about defining advanced practice across all 4 pillars of practice, across all 4 countries, across all sectors. And key to this discussion is that robust employer governance is also needed for safe and effective employment, utilisation and deployment of advanced practice AHPs. Regulation is one part of the larger public safety picture, but there are also responsibilities for others. I'm going to wrap up with a couple of slides. This one will look arguably very familiar. I'm sure these levels of practice are familiar now. That situates advanced practice, like we've already spoken about, between supportive assistive, entry, enhanced advanced consultant. This one comes from the dietetic framework because I didn't want to choose one or the other between OT and RCSLT, but I know these wordings sit very comfortably with the career development framework and the professional development framework within the professions. The important thing from a regulatory perspective is that HCPC does not require additional regulation for each level of practice. You are already regulated. As we've discussed, as you become more experienced, we appropriately extend our core knowledge that required us to be registered in the first place. And the exceptions are for additional activities, which are generally the ones regulated by law, such as prescribing, and the government decides who can and can't prescribe. But as Bev mentioned, prescribing is not a key feature of advanced practice. So to recap, when we refer to advanced levels of practice, it's not in any way restricted to specific roles. It's welcoming of a broad range of roles across sectors, across settings, and the many, many places where speech and language therapists and occupational therapists and all AHPs work. So of central importance is the need to work within our individual scope of practice, but identify ways to grow it, align that with the scope of practice for our profession and for those in substantive posts within the remit of your job descriptions. And safe and effective practice is a shared directive between the registrant, the regulator, the professional body, the national bodies, and where relevant, the employer. So my final slide is the team organising today. Thank you for kindly letting they create some space for me to share the work we're doing at HCPC. Just pop on to the next slide if you can, please, Claire. Thank you. We're hosting a series of interactive webinars to support experienced registrants like yourself themselves in enhanced advanced consultant level roles and equivalent, and also the managers and strategic leaders supporting them. We're about halfway through now. We've had over 5,000 people register for these events and they're going extremely well. Some brilliant questions and conversations like the ones that we're having today. So if you feel you would like to join us, we would welcome you there as we explore all of these aligned topics from the things that we're talking about today. So thank you very much for your time, and I'll hand you back to Will.
Thank you very much, Steph. That's fantastic and really, really important to have you from HCPC perspective as well. But Steph's also been involved with all of our professions in great detail. So we're really grateful for Steph joining us today. Thank you. So next we'll head over to Karen Orman and Claire Guyat to finish off today. They're both from RCOT and will offer a perspective from both professional bodies and everyone else involved in this work. So thank you.
Thanks, Will.
I'm just trying to find you now to spotlight you, sorry.
That's all right. Hello, everyone.
Here we are.
Thanks, Will. Can you just move on to the next slide, if that's okay?
Absolutely.
Thank you.
Hi, everyone. I'm Karen, and I am Director of Practice and Innovation at the Royal College of Occupational Therapists. So it's my job, really, to share some thoughts. And I just have to say thank you to all the speakers. This piece of work and this kind of drive and move forward is the sort of thing that gets me out of bed and gets me very excited and feels very privileged working at the Royal College of Occupational Therapists. I hope from today that you will leave feeling excited and curious, but also with a head full of questions. We've thrown a lot of information at you, and there's just so much, I think, to love about this piece of work. And I just want to say that thanks to Steph for her quote from Nankara Borthwick. It's going to be my new quote that I'm going to adopt at the moment. I think it's a fantastic way of positioning and explaining AHPs. So we've had, and many of you have gone through the ACP model and done various programs around advancing their practice, and we know that that might be the most appropriate option for you in your setting, your area of practice. But this advancing model aligns our practice and our expertise to meeting population health needs, addressing health inequalities, aligning to moving towards a more public health prevention model, and also that neighbourhood and community delivery. So I think it's a really exciting option for us to try and work together to take forward. I just want you to think about a couple of key headlines from today. So the 4 H's, that happy, healthy, housed and hired, that really sings to me and captures the complexity of people's lives and their needs that we try to address in our everyday practice. The idea of professional authority at an advanced level. This is looking beyond a service and addressing the wider population need. And then finally, that generalist and specialist capital T that really captures scope of practice and applied expertise. We know that across all 4 nations, there is a move in terms of health policy for us to start to move towards prevention, public health, and really looking at housing, all those social inequalities that impact on people's health. This is our opportunity, not only to sort of advance our knowledge and expertise, but to make sure that we are positioned to meet that wider population need and to have just the biggest impact on improving people's lives. So I hope you go away and think about, what are my questions? Feedback to us. We'll have a feedback form. And then collectively, we can think about how we work together to socialise the concept of this model of advancing practice, but also to think about how we can actually develop programs and support people to develop their expertise through this particular route. Thank you. I'll go back now to Claire.
Thanks, Karen. Wonderful. And yeah, just from me, a reflection. Thank you, everybody, for your amazing engagement in the chat. I couldn't keep up with it all, but it's just brilliant. It shows the energy we've got around this. And as we've said, this is the start of a journey, the start of a change movement. And we need that collective effort between all of us to move this forwards. This is bigger than just one organisation or two professional bodies. We need to join together and work really collaboratively to move this forward. So thinking about that, please, can you help us shape the future with this? And we've got some of your ideas and thoughts and conversations in the chat, but we'd love to invite you to share further reflections. It might be that you need to go away and digest some of the information, because there's been a lot of information in this session and it is recorded, so you can go back and sort of update yourself if needed. But there's a QR code here, and also I think Vicky's just shared in the chat a Microsoft form that we've put together to gather and capture your reflections and your thoughts. Please be completely honest, and to be able to make this change happen, we need to reflect on your thoughts and really be change agents together in how we can move this forward. So encourage you to do that. It looks like we're going to finish early, so if you feel you want to do reflections straight away, please do, but we will keep it open until the 31st of October if you wanted to go away and add some comments afterwards, and for those who haven't been able to join us today to catch up on the recording and to add their thoughts and reflections there. And then finally, and most importantly, a huge thank you. So I think we're on the next slide. Thank you, Will. A huge thank you for our speakers today, to Dr. Kim Stewart and Louise, who were brave and bold in taking this work forwards in the first place, and everybody who participated towards that. Thank you to Beverly and Steph and Karen for really giving us the foundation and that strategic look forwards. And thank you most importantly to everybody for your engagement and capturing the excitement in the chat like you have done. There's been great opportunities for you to network and link in, and just to reiterate, this is the start of this journey. So we will see each other again, I'm sure, in the coming weeks and months as we move this forwards. And just want to say thank you everybody for coming and engaging today, and we'll finish a little bit early for you to take some time to reflect or connect on the chat any further. Thank you. Bye bye.